Good afternoon, students. The next topic today we are going to start with is artificial ventilation and human respiratory disorders. Now, ventilation or ventilator. So we all have heard about this, right? Ventilator or ventilation. This is generally used in the hospitals. So artificial ventilation, it is also called as artificial respiration. Now, this is a type of a method where this is a type of a method which generally involves inducing of breathing in a person, where the person generally fails to respire normally, right? Now you know very well, whenever there is a breathing problem, right, so the person is generally given a ventilation. Why? So that there is an induction of a breathing in a person because of ceasing or faltering of a normal breathing. Now, if the ventilation is generally provided to a person at a accurate time or at a, you can say, approximately whenever it has been required, right? If it is given quickly, then it can prevent the death, right, due to the drowning, choking, suffocation and electric shock. इसका मतलब अगर पर्सन का ब्रीदिंग नॉर्मल नहीं है तो उसको वेंटिलेटर दिया जाता है, और वेंटिलेटर देने के बाद अगर आप वेंटिलेटर एक सही समय पर दे रहे हो तो इट विल जनरली प्रिवेंट द डेथ फ्रॉम ड्राउनिंग, चोकिंग, सफोकेशन और एनी काइंड ऑफ इलेक्ट्रिक शॉक, राइट? नाउ this ventilation or whatever the ventilator we are generally providing to the patient, that only has a efficiency for providing oxygen to the lungs, right? So the lungs will generally get the proper amount of the oxygen. Now this process generally involves two steps. First is establishing and maintaining an open air pathway through the upper respiratory tract towards the lung, that is forceful inspiration and expiration. Forceful inspiration and expiration, that is mouth to mouth. And second method is by mechanical method, that is ventilator. So two methods: you can create a open air passage to the upper respiratory tract up to the lungs, that is mouth to mouth, and second, you can generally provide a ventilator. So what exactly is ventilator now? Ventilator, I told you, it is a device, or it is a device. Majorly it is a device, or it is a type of a instrument or a method which is generally given for a patient in order to provide oxygen efficiency towards the lung. It is also used during surgery. It is sometimes used whenever a person is generally having lung disorder or a condition where the normal breathing of a person is failed. This is the method through which the ventilator or the ventilation is generally given to a patient. Secondly, this ventilator is generally used in a hospital as a life supporting system. So every kind of, whenever there is a critical condition or whenever there is a chronic condition, the person is generally given ventilator. The major use of the ventilator is nothing but to provide oxygen during the emergency condition, right? It also removes the carbon dioxide of the lung and it helps the patient to breathe properly. That is the major function of the ventilation. Now, let's talk about human respiratory disorders of human respiratory system, that is respiratory disorder. The first one is emphysema. Alright, now what exactly is emphysema? Emphysema is a type of a COPD, chronic obstructive pulmonary disorder, right? Chronic obstructive pulmonary disorder. Now this type of a disorder is generally caused due to the smoking or some of the air pollutant, etc. And symptoms shows that there is a breakdown of a alveoli sac, right? Alveolus, whatever the exchange of gases is there, that will be reduced. That is all about your emphysema. Second is called bronchitis. Bronchitis is the inflammation of the bronchi. We all know that the trachea gets divided into the two branches called bronchi. So inflammation of the bronchi is called bronchitis. Now it might be two types. One is called chronic bronchitis and second is called acute bronchitis. Now in chronic and acute, the major differentiation is that in the acute bronchitis you will get a yellowish color fluid or mucus which has been eliminated out or which is generally released out. That is the major condition which takes place in the acute bronchitis, and there is the inflammation of the bronchi. Third one is Sinusitis. Sinusitis is nothing but inflammation of the sinus, right? Okay, the sinus generally get inflated, due to which it can be a viral infection, bacterial infection, etc. Next, laryngitis. Now, when you talk about laryngitis, laryngitis is inflammation of the larynx, right? सबको पता है larynx is also called as voice box, right? और phonation box, क्योंकि वो sound produce होता है due to the vibration of the vocal cord, right? तो ये जो laryngitis है, laryngitis is inflammation of the larynx, and it may also lead to the hoarseness, sore throat. Hoarseness you might get sore throat. These are all the common symptoms of the laryngitis, and it is also a bacterial or a viral infection. Pneumonia, it's a bacterial disorder. We all know it is caused due to the Diplococcus pneumoniae bacteria. Here also there is an inflammation of the lungs, majorly in the pneumonia. There is an accumulation of the mucus fluid. Mucus fluid generally gets developed into the lungs. There is a greenish color sputum which has been released whenever a patient generally suffers from pneumonia. Asthma. Asthma is an inflammatory disorder of the upper respiratory airways or the passage, right? That is called asthma. Now, what happens exactly in asthma? The asthma is generally caused due to the narrowing of the air passage. The air passage or the pathway through which the air enters inside, that gets narrowed, due to which there is no proper breathing, right? That due to which the asthma generally is caused in a patient. It may lead to the wheezing sound and dyspnea, right? The person is not able to breathe, right? Due to which the sound produces, that sound is called wheezing sound, and inability to breathe is generally called dyspnea. Now, what are the causes for asthma? It might be smoking, it might be alcohol consumption, right? Cigarette smoking. These are all the reasons due to which a person can undergo asthma. And the last one is called occupational lung disorder. Now, occupational lung disorders are the disorder which are generally caused to a person or a workers who generally work in such kind of industries. Whenever the dust particle containing your asbestos or the silica particle are mixed in the air, and when they are being inhaled, that time a person generally gets occupational lung disorder. The first one is asbestosis and second is silicosis. Asbestosis is generally caused whenever there is a asbestos particles which are being inhaled through the air enters inside the lung. That time the person generally suffers from asbestosis. And silicosis is generally caused due to the silicon particles. Whenever there is a consumption or whenever we inhale, and if silica particles are generally inhaled, then generally a person suffers from silicosis. So these are occupational lung disorder. Thank you.